Welcome back. It is great to have you here at Mid-Morning on WKYT. You've been sharing some experiences as a parent
yes.
here.
And all parents can relate to this topic, certainly.
It can be a struggle to get kids to take their medicine.
It can also be a struggle to know exactly when to give them medicine or not. Dr. Nicole Peritore, a family health specialist, is here with some tips on that. Thank you very much. And you're in the throes of it, aren't you?
I'm in the throes of it, yes. We were just discussing right now, I have one that's just started amoxicillin for a little ear infection. And we talked about this is a medicine that's going to help your ear feel better. I let him smell it. Of course, amoxicillin smells better than some others out there. But talked about it first. And so that's one thing I really encourage parents to do. Talk about, you know, if your child's going to be taking a medicine, what they're taking it for, how it will help the child.
So it does help if they know that it's going to make them feel better.
Absolutely. At least it helps them know that it will help whatever's hurting them or what the issue is with the child.
What about on some issues, are there times that there are ways to treat it when you don't really need to take medicine, other ways like a common cold or something?
Absolutely. A common cold with a stuffy nose and, you know, maybe some headaches, some over-the-counter medications typically are more than enough. So saline in the nose can help loosen up the congestion. And when you have little ones, it's typically a little bit easier to use nose drops. As your children get older, they may want to try just plain saline, but let them do it themselves so that they don't feel that uncomfortable feeling of somebody else putting it in their nose. And then just some Tylenol as needed.
So, you know, if the doctor, the healthcare professional has determined that some kind of antibiotic or something is needed, there's that temptation, 2 or 3 days, they feel a little better, stop giving it. Don't do that,
yes,
right?
Definitely do not do that. It is really important to use all of the medication as prescribed. So for something like amoxicillin, it says, you know, use until it's gone. And that really is what is suggested. If you cut it short, what can happen is it won't totally get rid of that bacterial infection, and then you'll have another issue. So it is really important to follow those directions when you're taking a prescription.
And maybe the next time you'll have an antibiotic that doesn't taste quite the same as amoxicillin. Some of them are very difficult for kids to stomach.
Absolutely. So there are medicines that are difficult for kids to stomach. If you know that your child doesn't take medications very easily, talk to the pharmacist and see if there's some ways that maybe they can help you suggest to get it down a little bit easier and maybe different ways to take it.
Okay. Thank you so much for coming in.
Glad to be here.
A topic that
and
parents
good luck
can relate
with yours
right
now. Hope you are healthy or he's healthy soon.
Thank you.